I came to this community 7 years ago specifically to establish an epilepsy program. How I came to epilepsy as a passion is the fact that as disease states, they're really a disease that affects people's relationships with the world and it affects them on a very personal level. And so the disease and the person can at times become identified as one. Epilepsy is an example where, unfortunately, there's still a lot of stigma associated with it. People are frightened by the word epilepsy. And so it's a disease that really can impact your whole life. I was also drawn to it because it's one of the fields in neurology where there's something we can do. We can make a difference. There's treatment options available. Ultimately, it gives me the tools to allow people to achieve their greatest capacity. Seizures are frightening, but epilepsy is more than seizure. There can be problems with mood, attention, concentration, personality, information processing, memory and recall. So there can be a lot of manifestations of epilepsy besides seizures. A third of all patients with epilepsy can have depression. We tend to focus on the overt and not the subtle, although the subtle can be more devastating. When I was treating another patient who had a stroke during a pregnancy and has epilepsy, I continued treatment of the patient not just till she was seizure-free, but until her personality went back to the point where the husband said, "That's the woman I married." Returning her personhood back to herself. It's just not seizure freedom. The most important thing to me is that patients feel as if someone cares for them, they have someone on their corner. What I will never do is ever abandon the patients. Even if we can't achieve seizure freedom, even if we have a problem that's intractable, I'll be in your corner fighting this disease. So know that you have an advocate for someone who has expertise and compassion.